comments. But my name is Dr. Isang, using this platform as a way to reach out to people in regards to heart health and prevention, talking about things that can lead to heart disease, things like hypertension, high cholesterol, diabetes, strong family history, not exercising, smoking, genetics. So let's go. Let's go. One, if you can hear me. So why is this important? Prevention is a lot better. It's a lot cheaper. It's a lot more efficient than treatment. Break that down a little bit further. So if you have a heart attack, that is multiple thousands of dollars each and every year, sometimes for certain individuals on a quarterly basis, with all the treatments, all the tests, all the medications, evaluations, and making sure that you're at tip top shape to prevent another heart attack, to prevent another episode of heart failure. Now we compare this to understanding what the risk factors for heart attacks are, things like high blood pressure, obesity, smoking. If you can treat that, you can prevent a heart attack. You can prevent the thousands of dollars that you, your family members, and friends will have to utilize in your treatment. So kind of use this platform to let's go. Yeah, name is Emmanuel Isang. So use this platform to discuss things regarding the heart health and prevention and what things that we can do. So, like I said, high blood pressure is probably one of the biggest between high blood pressure and smoking. One of the biggest modifiable risk factors. I would say high blood pressure is the biggest risk factor for heart disease, and smoker for heart disease. So if we can control that better, we can potentially prevent something bad from happening. Not just heart attacks, heart failure, strokes, and all the downstream effects, kidney disease, end-stage renal disease, needing to be on dialysis, dementia. So just paying close attention to your blood pressure. And more importantly, people have high blood pressure and they know and don't know that they do have it. It's one of the reasons why high blood pressure is also known as a silent killer. So they don't know it until they have a heart attack. They don't know it until they've had a stroke. They don't know it until they're being diagnosed with heart failure. And sometimes they can go months, multiple decades with high blood pressure and not know. So it's always important to follow up with your medical provider, at least on a annual basis, sometimes twice a year, just to be on the safe side. If you have any risk factors, maybe even more frequent, anywhere from 1 to 3 months. I've even had some patients come in, 6 weeks, 1 week for a follow-up visit. So it's always important to make sure that you're not at risk of having heart disease. You're not at risk of developing heart disease in the future. So following up and high blood pressure, what can we do in regards to our blood pressure? What can we do without medications? I feel like a lot of people think that people in the medical field push medications a lot, when the reality is, by the time someone has come to me, they already have all of the risk factors, so that if we don't treat it now, if we don't correct it now, something bad is going to happen. So we have to bring that blood pressure down drastically over the next few, days to weeks. So if you're not at risk, you can bring it down slowly with weight loss, with watching what you're eating, watching your diet. The DASH diet, dietary approach to stop hypertension, is one of the good diets that focuses on decreasing the amount of processed foods, red meats, as much as possible. Exercising 30 to 50 minutes a session for 3 to 5 sessions a week, totaling 150 minutes of moderate intensity activity. I care more importantly about being consistent. So if you can only utilize 15 to 20 minutes, then do that and be consistent with it. How to quit propranolol for anxiety with time. With if you're taking it daily or twice a day, then talking to whoever prescribed it to see what are ways that you can bring that down in a careful manner. Because if you cut it cold turkey, you will start to have symptoms of it. Of palpitations and anxiety. So sometimes going from twice a day to daily, to every other day, to every third day, to once every fourth day, and then finally coming off of it. So that's going to be the best way to but most importantly, following up with whoever prescribes you with that medication. So, back to hypertension, back to high blood pressure. If you see that you're losing weight, you've changed your diet a lot, what else can you do? Watching the amount of stress that you're under, because stress is a huge component when it comes to heart disease. Stress is a huge component when it comes to high blood pressure. If you're not getting enough rest, ideally 7 to 8 hours a day. If you're stressed, if you're not meditating, if you're not giving time to be able to um, if you're not able to focus on whatever's causing the stress in your life, you will have difficulty in controlling your blood pressure. But also, if you don't follow up with your primary care provider, Trev, Age, I hope you're doing good. If you're not following up with your primary care, because there are a lot of individuals who have high blood pressure, but it's secondary to something else. The high blood pressure is due to something else. This is known as secondary hypertension. This is high blood pressure that's due to sleep apnea, high blood pressure that's due to issues with your hormones, high blood pressure that's due to issues with thyroid. So if you don't get that other issue checked and treated, your blood pressure remains elevated. In the United States, one of the biggest causes of secondary hypertension is sleep apnea. So if you're snoring, or if you're getting 7+ hours of sleep each and every day, but you're still finding yourself tired, if you're daytime sleepiness, make sure that you're getting checked for sleep apnea, to make sure that you're not at risk of developing it, or have sleep apnea, because if you don't get this treated, it can not only cause high blood pressure, but it can cause damage to the heart over time. So but we've done the nutrition, we've done the weight loss, we've done the making sure something else isn't causing it, and your blood pressure is still high, then this is when you need to be on medications for it, therapy for it. So what are the mainstream medications for high blood pressure? So you have calcium channel blockers such as amlodipine, you have thiazide such as hydrochlorothiazide or chlorthalidone, you have ACE inhibitors, lisinopril, aldosterone receptor blockers such as losartan, and then there's a lot of other ones, spironolactone, hydralazine. Most importantly is checking using the medications that's right for you, using the medications that causes the least amount of side effects. Some of them can cause ankle swelling. Some of them can cause issues with potassium. Some of them can cause headaches. So if you're already prone to having these, then we typically will refrain from using that medication for you and choose a different one. But also understanding that if you have other risk factors, there are some blood pressure medications that's better for you compared to somebody else. For instance, if somebody has diabetes, they ideally should be on an ACE inhibitor or aldosterone receptor blocker, not just for the blood pressure, but to help to protect the kidneys.